So I've known you for a long time. We overlapped a little bit at UCSF.
Yep.
But then you went on to amazing things down at Stanford, and then of course to iRhythm and beyond. So I'm going to touch on a few of those things, and I realized you've been a mentor to me for many years, and I've never really asked you some of these questions, so I'm dying to ask. So I think probably a lot of the people in the room have actually used the Zio patch that you developed at iRhythm, and so we all know the value that added. And as you look back at that experience of doing your clinical EP fellowship after so many years of training, and then making a decision to go into biodesign, and taking that step, you were interviewed by the ACC recently, and you said at some point when you have an idea, you really need to take a step back. And I think that had two contexts. One was, is this the right product for this problem? What are the other possible solutions? But then you're a physician, you're a practicing physician, taking a step back and say, what am I going to do with this idea that I have? And if you could just give a few words about how you made a couple of those choices and why that was such a critical moment of your career.
Cool. Well, thanks for having me, and look forward to maybe, we've known each other, and we live only 2 blocks away from each other. So I think for me, I always knew I was interested in device development. So when I was at Harvard Med, I actually thought I'd be an ophthalmologist, but my dad's a cardiologist, like, I'm never going to do that. But something happened, and I got more and more interested. But at that point, I'd gone straight through my training and had not really thought. And again, probably a lot of you, if you go through medical school, college, medical school, you really haven't been thinking. You use devices, you use technology, but you really don't think about it. So I actually took a year off to get a company that friends of mine were doing back in the late 90s. It was using 3D printing to print models of real anatomy to basically plan complex surgeries. So it was a very interesting foray for me to understand, this sounds cool, but is it real? Is this something that I would really want to do? Because I think a lot of people look at the grass is greener on the other side without really understanding what the grass really looks like. Being an entrepreneur is not simple, easy, and from a risk standpoint, it's maybe the choice any physician is not built to make, given the why you went into medicine. So, but I knew I wanted to do that, so I kind of really went fast. So I did my residency at Columbia for 2 years and came here and did cardiology and EP in 2 and 2. So I did everything in 6, because I knew where I wanted to go. And then I was at the biodesign program, which was where I still am in faculty, where we teach a lot about innovation. So I think I had a plan. I had a plan early on, but I was gathering data, like a good physician, about, is this right for me? What would it entail? What would it mean? And I think I learned from that experience that physicians are in a very good position because you're seeing unmet needs all day long. I get to the second part of your question about take a step back. You're seeing unmet needs all day long. Most of the time, most physicians, they're seeing widgets all day long that they think they could use to solve a problem. And so I think one of the things I always like to do and what we teach at Stanford Biodesign is you'll know you've learned our process when you encounter a problem, you're actually thinking about the problem and the need. You're not thinking about, well, I have this idea. Well, ideas are great, but ideas have to be solving a problem. I can't tell you how many people I meet who can't articulate why the problem they're solving is important, not just to them, but in general from a clinical, economic, healthcare value standpoint. So I think the first thing you have to do is really take a step back when you're thinking about something and first analyze, is the idea I have solving my problem, a bigger problem, the problem of my friends, problems of other people? And then more importantly, I think the most important thing that I tell folks, our fellows too, if you're interested in this, is this something that you've always been running towards, or is something you're running away from? This is a hard piece of advice for physicians, because medicine, my wife's the chief of the UCSF ambulatory clinic right there, so I know this place very well. And one of the things that always we talk about is, a lot of physicians, the practice of medicine is harder and harder for a lot of reasons which have to do with EMRs, technology, coding, a lot of stuff, reimbursement. If you look at the inflation-adjusted salaries for physicians, it's not the same as many other fields. And we live in this city where, being a physician, you think you could be able to have a reasonable living. It's very difficult in many ways for some, especially with families and debt. And so when you think about entrepreneurship and you see all of the buildings and all of the companies around here and all of the very well-to-do, it's hard to think like, that looks really interesting. But you have to think about, take a step back. Are you running away from medicine because it's not what you thought it was, or are you running towards something that was always in you? And I think a lot of people don't think about that because when you have to think that critically about yourself, you have to think about what are my weaknesses? What do I not know? Physicians hate to think about what they don't know, right? You know, it's just not in your DNA. But that's actually the most important thing. I think some of the advice Tom Mark gave was really important. One thing I would add is like you really need to listen to other people. Again, something physicians don't really do that well. Really listen to those people around you who are experts, be they investors, other people, your family. Like sometimes you make decisions like this is what I want to do, but how's the impact? So take a step back really means to be self-reflective in many ways more than just professionally. And if you start with that idea, you'll come to probably a better realization of, is this the right path for me? Is my DNA built? Because honestly, if most people go into medicine, it's a good pathway. You're going to do something to help people. It's a respected field. You get good grades. So you're not built to just throw it all to the wind and see what happens.
No, that was fantastic. Thank you. Actually, some things for me to think about too.
There's some other things I'll build upon that as a physician and trying to be an entrepreneur. Yeah.
Yeah. So tell us. I want to get to element science because iRhythm, obviously, massive impact on the field, I think, and I view what you're doing at Element Science as a step function, going from diagnosis to now diagnosis plus treatment all in one. I get the sense from your website, from some of the marketing, that you're thinking even bigger than that in terms of not just arrhythmia, but disease management. What's your vision? What's your hope for what Element Science is doing right now?
I'll give you a little background. So after I finished the program at Stanford Biodesign, I was trying to think about, this was in mid-2000, 2006, and there was a lot of opportunities for cardiac EPs at that time based on a lot of trials. So I was thinking what to do, but one of the things that I did was take some time to step back and do some needs finding. I hadn't done it for about a year, and that means really thinking about what are unmet needs at the field, where my field has not solved. And there was an interesting paper about a sub-study of Valiant, which is a heart failure study, about the high risk of sudden cardiac death in the first 30 days after an MI. And as an EP, I was like, and someone who's interested in thinking about problems, like, oh, how do we treat that? And there really wasn't many ways except this product called the Zoll Life Vest, which is it's like a tight vest that people have to wear and take off when they shower. But it works, but it's very, very, very challenging. It's a lot of devices in the past were built with the mindset of we build a product and we make the patients use it. But obviously, as things have improved, things have changed and things are moving outside the hospital, there seem to be opportunities to think, what can patients do? What will they do? And how can we solve the problem with that frame set? So I basically filed a patent for basically taking an AED and putting in a defibrillator pad. That's it, a patch-based defibrillator. This was before iPhone 1. So this is 2006. And so, when I started really doing the math about how would I solve this problem from an engineering standpoint, it would have been challenging from miniaturization, cost, other things. And also, back to what I was saying earlier, at that point in my career, I'd taken a year off to be an entrepreneur for 1 year. I'd gone to some good programs for training, but I didn't know, I can't use the word I would use, but I didn't know that much. So I think the reality was, okay, this is a big project. It's a defibrillator. It's technologically challenging. It's adhered. No one's even really adhered products to the body for that period of time, a month, 2 months. I'm not the right person for this idea at this time. That is another thing that is very difficult for physicians to think about. You may have the right idea, you may have a good understanding of the problem, but you may not be the person to take it forward. And for me, it was at that time. For other people, it may be never. It might be later. So I think you just have to think about it, because what that product needed was a lot of other technology innovation, as well as someone who knew how to run a business. That's a class 3 device, which means it's life-saving. It's a long regulatory path. So then I said, well, there's this other project, but again, naively, there's this small project called iRhythm. So I licensed the technology back, started that company in my apartment. It was just, a lot of things that we didn't really understand. That was really more about a product, a patch-based device, but the real secret sauce was all of our algorithms. We were very early adopters of using Amazon's cloud. We were on S3, which is one of their instances, back in 2008-9, very, very early. We did a lot of things that were not typical in healthcare, but I hadn't really thought about that at Stanford. It's just that when you start getting out there and start really understanding how do you solve a problem is oftentimes not one piece. There's multiple pieces. So I like to think of iRhythm as a healthcare IT company enabled by a novel device supported by a service. We had to build all legs of that stool to really be successful. But anyways, your earlier question, so that experience taught me a lot. And again, I started that company not to be successful. I just really want to see the full arc of how do you take a need that you think is important that other people, and I will tell you that my goal that summer was to go to people I respected, Paul Yock, who's invented a lot of cardiac devices, who's at Stanford, Bill New, the inventor of the pulse oximeter, Julio Palmaz. These are all people in our sphere at Stanford. And I basically, the one question I had for them is like, tell me why this idea is bad. Because if you know something, I don't want to waste 2 or 3 years of my life if you could just tell me that. Again, another lesson, a very difficult question for physicians to ask, tell me why I might be wrong. Very not easy to do, but you really want that insight. And I think it's important to get that direct feedback. So all of those lessons learned, the goal was to just see how do you go, what are all the steps, and learn. And that's what, for those of you who've never done this before, any venture or anything you do now, the goal should be learning, because it's fun, because oftentimes medicine becomes a little bit, can be rote. Trying something new and doing something, if it's more of a learning opportunity, not a raison d'etre of this is what I'm going to do for the rest of my life, even though you don't know if it's for you or not, is a good way of thinking. So Element, as a wearable defibrillator, that was really the unmet need we started with. And so fast forward, I was at Third Rock for a while, and they and Google Ventures are my funders, my initial funders. There's a big unmet need here in LifeVest sales as they went up and people recognized the unmet need in this first 30 to 90 days. There's a lot of opportunity for building devices. And I was just at a Google Ventures function before coming here, and my investor there, Krishna, who's also a also a physician, Krishna Yeshwant, some people used to ask him, why did you invest in us? Because they don't do many medical devices. And one of the things I remember him saying one time was that we really focused on design. One of my first hires was a real head of our design and UX group, because we really want to understand what can patients do. We kind of had an understanding what are the components of a defibrillator, how big they are, but we really didn't design the final product until we first watched and thought about what people would be able to do, how often could they really change something, what would really move the needle economically and clinically. And with that set, really understanding the design and UX, that's what we built our product into that. And so we took a design first, and we've always done a lot of human factors testing, et cetera. So as we think about these wearables, and again, this is a wearable defibrillator that can shock you. If I was wearing one now, you wouldn't know it. I mean, we've got them down to about 2 iPhone 6 Pluses, in weight. You stick your body for a week or so plus, and then you change the patch and keep going. But the idea would be patients care about not having anyone else know that they're potentially sick. They care about trying to forget about the fact that they could die. I mean, you don't want to be reminding them all the time. The LifeVest does. So there's a lot of things about just thinking about if you were a patient, if this was your grandma, what would be important to her, or loved ones. And so with that, there's also larger scale opportunities in thinking about how to use personalized devices that are clinical medical grade, like really, sensitivity of detecting ventricular arrhythmias at 100% because you cannot miss, but not having such a bad high sensitivity or focusing that much, you have a poor specificity, so you have too many inappropriate shocks. But thinking about all that, how do we think about this hospital to home? So a lot of companies have really been thinking about products in the hospital, and a lot of people think about products in the chronic stable outpatient. But this transition period is a very high cost period of time with very high pretest probabilities of badness happening. And so can we use devices to better and more rationally deliver care? Because again, when we say 30-day risk, if each of us had an MI, each of our risk is different. 30 days doesn't mean the same to you or me or anyone else. So how do we use devices, data, in a rational way with a high enough probability that it's cost effective, that you're really gaining qualities? Again, all of these things, the first thing we teach whole health economic value to all of our fellows up front. Think about Markov modeling. How are you going to understand the pros and cons? Because again, echoing some of the points made earlier, you got to know your business, and for an investor, they just want to make money. And so it's fine, that's why they're there, and they're a source of capital, but you have to prove to them why it's not only a good clinical outcome, but a good economic outcome that they can verify with their payer buddies, who will then basically, so that the circle, of life for you as an entrepreneur is closed, right. So that, you get. So a lot of things that I've learned from iRhythm that we're bringing to bear now, but fundamentally, there's a lot of opportunities in this hospital to home space. defibrillator being one.
That's fascinating. And I am going to open up the forum to other people to ask questions. I wanted to finish my questions at least with getting back to the fellows that you were talking about. You spent a lot of time and still do training biodesign fellows here. You helped start and develop the Stanford India biodesign program. The whole process of needs finding, and Jackie just gave an amazing talk about some of the hurdles that AliveCore has had to solve as they've kind of progressed as a company and grown. But if you're starting off as an entrepreneur, if you have an idea, you have a product, you have the early beginnings of a company, we live in very interesting times right now in terms of government regulation or lack thereof. What do you see the landscape being in terms of the FDA, in terms of allowing for machine learning at the point of care, in terms of combining that software capability with hardware? And do you feel like that's a major challenge for you as a company? Is it something that an entrepreneur should be asking before they even get started with this process? Like, how should that shape what you do, especially early on in your idea?
So good question. I think I would be lying if I say I knew what FDA would do. I don't even know what the FDA does sometimes when we're talking to them month after month. For us at least, because we do, some people ask me, like, why would you go from a 510K product in Ireland and start to do a class 3 PMA product, which is very long, very expensive? I said, well, there's clarity. I know what outcome I have to get to. I know what I have to do. It may cost a lot. It may take a long time. I think it's worthwhile. I mean, we're one of the few companies where we can really say that we are working on something that will save your life. So there's a lot of value from a mission and clarity standpoint, but it's not easy. I think in terms of people thinking about starting a company, I've spoken about this at HRS in the past. So when I studied the med tech industry for a while when I was at Third Rock, it was very clear that 20, 30 years ago, if you had a good idea and a reasonable team, there was a lot of funders up and down Sand Hill Road that you could get money from with that, and you could figure out the rest, the regulatory, the reimbursement. That's changed particularly after 2007. There's again, just so understanding macroeconomic trends. So for instance, a lot of venture capitalists had invested in companies without fully realizing the length of regulatory and subsequent reimbursement processes, so they weren't able to make returns to give back to their investors. Economic downturn happened, in 2007-8. So a lot of investors, limited partners who give money to venture capitalists are now looking overweighted because their capital market investments have gone down. So now what used to be a bigger portion, now their venture capital investments look like they're much larger than they really are. So when the venture capital goes back to them and says, I need more money for my next fund, they said, we're already overweighted and our capital market investments are very down. We're not going to give you more money. So a lot of money left the market in medical devices, for some bad decisions in terms of not anticipating regulatory and reimbursement processes and their length, but also because of macroeconomic trends. And so that's still very difficult to come through. But one thing that people have learned is that you really need to know your regulatory and reimbursement process before you even start talking about your product. I oftentimes, when I talk to folks, let me just assume that your technology works, that it does what you say and it solves your problem. Walk me through what the regulatory path is, and usually now people have a clear understanding in some cases, other times not, and that's risk. And then on the reimbursement side, walk me through why you think the pathway you think, and really understanding, the time frame. So CMS unfortunately works on laws passed many years ago and hasn't really adapted. So if you don't know that certain groups, and I've had to testify in the RUC and other for our CPT3 codes for iRhythm, if you don't know when they meet, what the time frame of an application is, that there's a year delay, and you're building your company and you're building your fixed burn, and you just don't get that, and that comes across, those are really important because again, time is money, and time to return is an internal rate of return for an investor. Sure. So all of these things boil down to one thing I tell people, you've got to know your business. You have to know every aspect. I can't tell you how many CEOs I meet who just don't know fundamental aspects of their business. Not their product, not the medical need, but their business. If you don't know your business, then it's very hard to get funded. And people see through that because that's what they care about now. Wasn't so 20, 30 years ago. So.
And I see our two guests here in the front nodding there. He's right. So that was fantastic. And I want to stop talking myself and allow people in the audience to ask questions if they have them. Yeah, sure.
Oh, nice seeing you again.
It's almost a philosophical question, right? If you created something new, quote unquote, right? A new category, you invented something, you're an entrepreneur, etc., and you need to be a good listener, right? You are bound to be bombarded with negativity from the outside world, because, oh, what if this, what if that, right? How do you strike balance between being a good listener, right, and having the conviction, I know where I'm going, and not gonna do this and this and this. I'm gonna, go where I, wanted to go.
I think the first thing, again, putting my Stanford Biodesign hat is on, are you talking about where I want to go with my product or why this is an important problem to solve? The first thing you need to get is validation from somewhere, be it payers, other physicians, other people, that this problem you're solving is important. I can't tell you how many people have widgets that they think about, but they can't really get people to buy in that this is a problem or not a problem. So I think first thing is, you'll still hear negativity, like that's not a problem for me, but you got to get somebody to understand that the problem you're solving is important, and that it's not just you who thinks it's a problem, because you're really thinking at it from your solution first. We see that a lot. The problem becomes kind of a self-fulfilling prophecy, like which came first. So as long as you're objective about the problem being a real problem, and again, if you're solving a problem because it's not being addressed in the real world, it shouldn't be hard to convince people at some point, but you will get a lot of negativity. But once you get that past that, then the second part is also understanding that most of the people you go to invest from or get money from, they all have their own metrics. So some people are early investors, some are late investors. We only own this much. So we need to own that much. So just you might get a lot of negativity, but it may have nothing to do with you, but that's also maybe you're not going to the right people. So and that's why I'm saying, if you know your business and you're like, well, this is going to be a project that takes $50 to $100 million, and you're going and asking for the first 5, you need to know that there's going to be a lot of dilution after that, because the investor guy up front will be, or woman will be like, well, I see why this is great now, but I'm going to get really diluted. How is that going to work for me? Because we need to be exiting in 3 years, and that's what our fund does. So there's a whole spectrum of negativity, but you should listen to the negativity and try to understand the reasons for it. Sometimes it has nothing to do with you. Sometimes it does, and sometimes it's good. I remember raising the money for iRhythm. Our first Series A was $12.5 million, which is a good-sized Series A for a diagnostic back in 2006. VCs weren't really typically doing that, but the way I went about it was, which what we teach at Stanford Biodesign too, that we've incorporated in our book. We look at milestones that are risk mitigating, because at some point, every company out there is a series of distributed risks. The key is, at every point in time, how does the money you've raised from taken one of those risks off the table? Not the risk you take. I can't tell you how many engineers come with me with a prototype. Sometimes that's important. Sometimes I didn't have a prototype iRhythm. People thought, you'll figure that part out, but can you change this business paradigm? That's the hard part. And that's why we needed to build a team that has done that before, or other types of things. So anyways, you want to really understand kind of what are your risks, how much money does it take to get to each stage, and then figure out, go talk to the people who do that, and then if you're getting negative feedback, well, maybe there's something there. On the flip side, if you start answering the questions that people are giving you that come up, investors oftentimes think similarly. So it's like there's only a certain number of questions they can ask. You'll get there when you get fewer and fewer questions. And so that's what happened to me. I went to a couple people I knew. I said, tell me why this sucks. Tell me why this is bad. Good point. Let me go think about that. Let me go work on it. Come back to them. At some point, a good answer. And then you see that they've engaged in the process. You've listened to them. I mean, like you said, these people see hundreds of pitches and teams all day. They don't need to deal with someone who doesn't listen. That's why? They have enough people around here who they can. So you don't need to be your own worst enemy in trying to raise funding.
Since you're involved in biodesign,
yeah.
I wondered if you've ever thought about the possibility of integrating an option for an innovation track in medical education. A lot of radiology residents are saying, man, I need to know data science because AI is coming on the path. I need to know what I'm tackling here. What do you think about that?
I mean, Bob Harrington's on my SAB too at Element, so we've talked about that. Oh, yeah, I'm sorry. The question about an innovation track for physicians at universities or training programs. So, Bob is on my SAB, and we've talked about this, and I know you'd know better since you're on the Stanford cardiology faculty. I think it goes back to what I was saying before. I think fundamentally understanding the technologies and the tools out there that are in the toolbox to solve problems, yes, physicians need to know that. I would say before that, you should understand how things work. I mean, I can't tell you, most medical people leave, they don't know, how did all these supplies get on the shelf? Yeah. What's a value committee? How do they make decisions? All of it. Why do we not get reimbursed enough? Why do we have to fill out these codes for review of systems? Just the basics of what you get hit with when you hit the real world, people should be teaching that first and foremost, just so you get a real understanding of the practice of medicine. Then I think you can start to expand from that. About some of the other tools and techniques, because I think it's like a wake-up call when you get into private practice or and you're doing all this stuff and what are these coder people? What is this stuff? Why do we have to do all this? You should have learned that, right? Because that's day to day. And so I think there's a lot of things that medical education, people who are focusing on medical education are thinking about. I don't know if they question enough about or spend enough time thinking about why are physicians burned out? Why is it so difficult? Why don't I spend any time with the patients? Well, there are probably things you can teach them that maybe help them better prepare for that.
Yeah.
Do you have any advice for people who want to remain sort of practicing
good question.
but still want to do something within the entrepreneurial space?
Yeah, so another piece of advice I give, which is a generality. The question was, if you're a physician, and you want to keep practicing, how can you also continue to be an entrepreneur, or participate in innovation or entrepreneurship? My personal feeling is that being an entrepreneur is a 150% job if you want to do it well. Just like knowing your patient, knowing your business. So I have to say, you have to pick your day job. Your day job is taking care of patients or it's being an entrepreneur. It's very difficult to do both. Now, you might say, well, I want to be involved in innovation. That's different. If you can participate in helping companies understand the unmet need, shadowing your clinic. You can do animal studies for them. I used to consult for a lot of companies in EP when I was younger. You could do clinical trials. But one of the reasons I don't practice anymore is, after getting triply boarded, is that you don't want a doctor, particularly proceduralist, who views it as a hobby. If I'm having an ablation, I want someone who does that a lot, not like once in a while. I think it's different for certain shift-based specialties or clinics or supervision, but in general, you need to pick what is this that makes you get up in the morning. If you really love seeing patients despite some of the issues in medicine, that's what you should do. And if you like thinking about their problems, figure out a way to maybe express that. And again, you have, unfortunately, in most systems, you have to get buy-in from your partners to take time off to do this, or buy-in for your boss to be able to not make your RVUs so that you have time that you've bought out to basically go do this, which means you might be bringing home less revenue, which may be okay with your boss. Is it okay with your family? Is it okay with your debt? So there's just a lot of things I don't think people, what I'm saying is not rocket science. It's pretty basic, but I think it's always this question of innovation, entrepreneurship. It looks really appealing. It's very difficult. It's very hard. It's super rewarding, not monetarily. It can be, but we've done almost 3 million patients with the Zeo patch, and we're doing a ton. And it's a lot. And so when people come up to me all the time, I wore one of that, it's very gratifying. That's why I did it, for that, not for the rest. But that's me. And so I think anyone who was thinking about it is what really motivates you? But I think it's hard to do both well.
Yeah.
So that's a tough one to answer. The question was if a patient wanted to figure out what device. If they're really thinking about getting healthcare devices for themselves, I think the bigger question they should have with their physician is, why? Why are they worried, or why are they concerned about their EKG? There's got to be a reason. And I think one of the things is, at the end of the day, we haven't changed in hundreds of thousands of years. The ability to know everything about us and find incidental things has become stratospherically high now. And so I think in medicine, if we really keep our hat on, do no harm, the lower and lower pretest probability patient population go, the higher the risk of finding false positives. So basic epidemiology, as a physician, you should be talking to your patients like, you know, you should get one of these devices because you have risk factors, and it would be good to know because you're at risk for a stroke. The vast majority, why are you looking? Because you're probably going to find something that may lead us to do X, Y, or Z. That's why we don't screen EKG athletes in this country, at least, I mean, or kids with EKGs, or do full body scans, because we all have abnormal, we have all normal variants. I think one thing I'll leave you with is well, if there are more questions, but I used to go to Walden Pond a lot when I was in Boston, it's Walden Pond, right? You know, it's a nice place. A few years ago, I went there, and, you know, I think Thoreau had been turning in his grave because everybody there was on their smartphone. It's like, this is probably one place where you shouldn't be using your smartphone. So I think it's one of those things that at some point, they're always worried well. But at some point, if there really isn't any trouble, I mean, the way I look at a lot of products in cardiology is like, if it doesn't make you move more, eat in moderation, or stop smoking, you can't battle your genes. What information has it given you that you didn't already know? Those are 3 of the hardest things to do. So if you could do even a little bit of that, that's the elephant in the room, right? You know, knowing your EKG every day if you have a low pretest probability versus walking a lot, it's very clear to any physician which one's probably going to have the bigger benefit. So I think it's much more about educating your patients and trying to put into your mind as a physician when you see a patient, what's their pretest probability of something bad happening? What is the thing I should really spend my time thinking about? And really hopefully allaying their fears, or, you know, you are at risk, you should use this. So I think it goes case by case, but fundamentals haven't changed. It's pretty basic things that are hard for the population to do.
Okay, I think that was a really great session. Thank you for the questions. Thank you for the time.
Yeah, sure.
And incredible insights. And thank you to Yuli and Rajesh again for hosting here at this wonderful venue. And everyone, I think some people will be still here for questions afterwards, but thank you.